Oh, hi.
Hey there.
I'm never early.
That was so weird because it's only like 1 minute before the meeting, but then it's like everybody pops on, right?
Yeah, but no one else is here. It is funny.
Oh, goodness. All right.
All right. I just talked to Jen.
Oh, good. Okay.
Well, she was very helpful. Yeah, she said the same thing of like with the subcontracts, like just estimate, we can work it out later.
Yeah. Yeah, exactly. Exactly. Hey there, Chris.
Hey, how are you?
Chris is in the office. Woo.
How is it over there?
Fine, quiet. Building's still standing.
Got it.
Yeah. Air conditioner works. That's good.
Yeah, it's still pretty warm out. Should be cool soon.
I know. You can feel it on and off. Hey, Lewa.
Hi, Melissa. Hi, everyone.
Hi.
Right. You're on deck today, right, Lewa?
Yeah, I'm doing presentation today, mainly for people's advice.
Awesome. Hey, Sasha.
Hey, Melissa, and hi, everybody else. Good to see everyone today.
Is that a new Sinai background? I haven't seen that one.
It is. I feel super professional now.
It almost looks like there's a golf course in like the lower left.
It's supposed to be like
Baseball
part.
field?
It's like the Central Park view.
Yeah,
Yeah,
the baseball field, all that
yeah.
there. Huh. Okay, there you go.
Sitting on the roof of Annenberg.
That's right.
Right above me somewhere, right?
Yeah.
Oh my God. All right, we'll give people a few more minutes. See. Hey, Ken,
Hey,
how are you?
good.
Oh.
I actually had this date penciled in. I thought I had to present, but then Caitlin corrected me and I was be happy to not have to do it.
Oh my gosh. Are you on for a later date then?
I don't know.
Okay. I can ask Caitlin. Oh, hey, Crystal. Hi, Deborah.
Hi, everybody.
Okay. All right. Evan, Patty, awesome. DG. Hey, DG. Nice to see you.
Nothing right now.
Yeah. All right, why don't we go ahead and get started here? There's a few more people who are logging on. Hey, Abigail, how are you? All right, updates. What do we have since last time? Anybody have any updates to share? Grants or publications? I'm not aware of any deadlines that we've got to talk about upcoming. So
I think this has been announced, and it's not really an announcement because you can always jinx yourself, but Emily did get a great score on her VA career development application. So we're hoping that that comes through, and really good news.
yeah, that's amazing news. So when is the start date for that? Like, how long does it take to actually get into action?
I don't know, is Emily on?
I don't see her yet.
I I can't remember. Oh, she might be doing her health and aging policy stuff.
Yes,
Emily said she's away today
Yeah.
and tomorrow, or today, yeah.
great. Okay, thanks, Patty. Yes, I did know that that was kicking up in October with that training. So that's probably what she's doing. We've had some great luck with that policy fellowship,
Yeah,
right? I mean, Diane and Bryn and Alex.
and Will Hung.
And
too.
Will, that's right. Yes. Oh, that's great. All right, so that is great news. Thanks for sharing. Anyone else? Any new publications out or anything like that anyone wants to share? Hey, Will.
I'm not sure if this was announced, but our, I think this probably was, the waiver, the hospital at home waiver evaluation was accepted and will be out pretty soon, I think in JAGS.
Oh, great. Okay.
Yeah, so a number of folks were involved in that publication.
Yeah.
Yeah.
All right, great. Thank you.
Yeah.
And so we have, most of you know, but for those who don't, we do have a, is it a monthly email that comes out from Katie Brown, who puts together kind of all of any publications with links from the department, any citations in the press with links to that, et cetera. So anything that's mentioned here, you'll see on her next email out, which is very helpful. So, and please submit to her anything new that you have that's published or out in the press. What does she call that again? Not rewind, that's what Sasha does, but milestones, that's what it is. Okay, so her milestones document is really helpful. All right, I can't recall, Leah, did we introduce you at the last WIP, which was 2 weeks ago? It would have been right around your start date, right?
Yeah. Yeah, but I don't know if everyone was on the call, so I'll just say hi again. I'm Leah Stroud. I'm I'm part of the T32 fellowship. I'm an instructor here in the department, and looking forward to getting to know you all a bit more. My dissertation, I looked at Medicare data sets and worked with nursing homes in palliative care and potentially avoidable hospitalizations, and looking to see how to expand on my research here. So.
Great. Well, welcome, Leah. We're thrilled to have you. And I know we'll get you on the schedule at some point so you can share some of your work as well with the group. So welcome. Anything else? All right. Why don't we go ahead and get started? Lihua, you're going to share some of the work that you've been doing.
Yeah, sure. Okay, let me share my screen. Can you guys see my slide?
Yes.
Okay, awesome. Today I am going to present an R01 proposal that I submitted this March. Unfortunately, this is based on the work that based on the Pepper Pilot Award that I got. Then based on that, I just building on that, I kind of expanded this proposal for an R01 application. But unfortunately, it was not discussed. But we still get quite a few helpful comments from the reviewer. So today my presentation would be not only showing my work, but also I'm seeking your advice and comment as well. So the proposal title is called Integrating Propensity Score Weighting Methods and Population-Based Surveys for Cancer Research. Why specific for cancer research is that there's a module R01s in cancer control and population science. And through this funding call, and NCI encourages application that address a variety of topics, including statistical methods. So specifically, we aimed actually, statistical methods for analyzing linked administrative and survey data. And as we know that many of us are actually using national representative surveys, a lot of us are using NHIS, including myself, MCBS, HRS, and some of those representative national survey can be actually linked to, or have already been linked to administrative data, such as Medicare mortality data. Then the beauty of, I would say the beauty of the bigger advantage of national survey is that findings based on survey can be generalized to the general population. So therefore enhancing the study's external validity. But sometimes the study using national surveys are also, like other observational studies, subject to confounding, therefore undermining the study's internal validity. Then we were thinking that based on that, we can propose a propensity score method, which can directly address potential confoundings. So when we integrate a propensity score with the national surveys, then we can maximize both external and internal validity, because propensity score can address this confounding issue, which national survey also suffered. But at the same time, national survey has the advantage of for us to make a population level inference. But then we were thinking that, okay, so we proposed the interpretation of propensity score and the survey design. After doing research, we realized that very, very few studies actually tackled on this area, and the critical gap remained with regard to the performance and implementation of PS method, especially for the PS weighting method for various type of outcomes in population-based surveys. As far as I know, by the time when we submitted this proposal, only 3 papers talking about propensity score method in the survey setting. I would say most of those papers just focused on the continuous outcome using the linear model. None of the study actually looked at propensity score method in the survey setting for the binary and the survival outcomes. Then in our proposal, we proposed the 3 aims. The first aim is to evaluate the performance of propensity score weighting method with 3 different approaches of incorporating weights, using simulated survey data to estimate population average treatment effect and the population average treatment effect on the treated for binary outcome. Also to estimate the population level survival quantile effect and the marginal hazard ratio for survival outcomes. That's the first aim. Then the second aim, we propose to evaluate the performance of propensity score weighting method with different techniques in estimating propensity scores. A lot of times we're using logistic regression, but there are also newer, much novel statistical methods such as covariate balancing propensity score, and also generalized boosted modeling, and also as well as a machine learning method such as random forest, naive Bayes, using simulated survey data then to estimate PATE, PATT for binary outcomes, then also as well as survival quantile effect and the marginal hazard ratio for survival outcomes. So both aim 1 and aim 2, we just focus on simulated data for binary outcome and the survival outcomes. Then in the aim 3, building on aim 1 and aim 2, we will identify the best performing propensity score method, then to study 2 real examples, 2 real questions. The first example, the first question is to study the effect of health information technology used on the subsequent healthcare utilization, mainly hospital admissions and ED visits among cancer survivors, then using the NHIS Medicare linked data, because here healthcare utilization focusing on hospital admission and ED visits are binary outcomes, which matches the first one of the outcome that we proposed. Then the second question is to use the best performing propensity score method to study the effect of smoking cessation after a cancer diagnosis and the subsequent survival. We focus on mortality, deaths here, then using NHIS mortality linked data. So for this example, we specifically correspond to survival outcome. Then in the significance, probably I think that's the main section. I'm hoping that I can get more comments from you. The first significant we stated is to maximize the value, is maximizing the value of population-based survey in two ways. One is utilization of linked survey data with other administrative database so that we can look at outcomes which were not captured by survey data. And also we can just follow those patients for much longer time, and then we can have their time to events. And then the second way is that applying advanced statistical methods, so which is also related to the second significance, reducing confounding and bias in population-based survey studies with propensity score methods. Propensity score method, as we know that as a statistical approach, try to derive the probability given observed baseline characteristic. Then based on this probability, we try to balance two groups. This approach basically is often used in observational studies to mimic a randomized control trial, which is not often feasible in observational studies. And then using propensity score method, the propensity score method actually has a wider category, but using the main purpose of propensity score methods here is just try to reduce the confounding, then further reduce the bias in the inference. And then the third significance, we stated that we will address the challenges in application of propensity score methods in population-based survey, because there's no study so far have evaluated the propensity score weighting method for binary and survival outcome. And then no study also compared different propensity score estimation methods using the survey data. So those gaps, and then I'm a statistician, so while we are in the real practice, we just perform this type of the analysis without really carefully thinking what's the best way and what's the best approach. And there's pretty no guidance on this area. Then I think to follow the significance, we also stated like 3 innovation. So this is the first study to examine propensity score weighting method with binary outcomes in survey data, because different. For the binary outcome, it's different from the continuous outcome. The PATE and the PATT is no longer the regression coefficient for the treatment indicator. But for the continuous outcome, when we do the regression, so the beta coefficient can be directly interpreted as the treatment effect. But for the binary outcome, when we try to derive the PATT and the PATT, then that we will have to rely on a weighted function in terms of the regression coefficients and the covariance. And then where the weight is chosen depends on the estimate of interest. So consequently, what I'm trying to say here is that for the binary outcome, there would be more steps involved instead of just using like a one linear equation, one linear regression, and then the beta can be interpreted as the treatment effect. Because of more steps will be involved, then consequently, there would be different approaches in calculating the population level treatment effect based on which step we are going to incorporate in survey weights. So this approach, this process would be more complicated. And then the second innovation is that we say that, you know, this study, our study will be the first study to examine propensity score weighting with survival outcomes in survey data. In the survival outcome and the treatment effect actually is not measured by the PATT or PATE. It's measured by the survival quantile effect and the marginal hazard ratio. So for the marginal hazard ratio, we often consider Cox pH regression. Then for quantile, survival quantile effect, we use the weighted Kaplan-Meier estimate. But so far, I would say there's no study actually examined the calculation of those causal estimation with appropriate accounting for survey weights. And also there's no study actually consider that what happens if there's influential outliers or proportional head assumption does not hold. And then the third innovation, we say that you know, this is the application of this would be the first application of traditional novel statistical PS estimation method in conjunction with machine learning models in survival data. So for example, there's really no comparison was done in estimating propensity scores in the non-survey setting. In this setting, and we will assess 5 different propensity score estimation methods, including logistic regression, CPBS, GBM, and random forest and naive Bayes. So for AIM-1, what the approach is that first of all, we define the PATT, define the PATE and PATT. Here, I'm not gonna go over too much detail about it. So basically, we kind of incorporate a propensity score and the survey weight into this weighted form. Previously, we proposed 3 approaches for this aim. So we proposed the unweighted method. So in this unweighted method, we don't weight in stage 1 and stage 2 by the survey weights. We only weight by the propensity scores derived from the stage 1, which usually we use the logistic regression. Then the second method is called stage 2 weighted. So for this method, we only weight the survey weight in the second stage, just weight the entire regression by the product of survey weights and the propensity score. Then the third method is both weighted. So for both weighted method, we consider survey weights in both stages, including logistic regression, including the propensity score estimation model and then outcome model. Because actually 2 reviewers questioned the significance. So we were thinking that maybe we should just shift the focus a bit, because previously I think we were just trying to propose that we're trying to advocate that survey weight should be definitely considered when we are doing the survey studies. Now I think this message maybe is too obvious, and then some of the reviewers were just thinking that this type of the research has been already done for the continuous outcome. So could it be just also applied for the binary and the survival data? Now we are thinking that maybe we should focus on how to incorporate propensity score appropriately. So after revision, we currently consider 8 methods for binary outcomes. So we consider 2 stages, 1 stages, because so for example, in the first stage, we just say that a propensity score is derived, everything is well balanced. Why should we do the second stage regression? We can just use the propensity score, combine the survey weight, and directly to this formula to derive PATT and the PATE, right? So this is one stage method. And then we also proposed 4 different methods for 2 stages, depending on how we incorporate weight into different stages, either in propensity score estimation model, or in the second stage outcome model, or maybe in the weighted average form. So which specifically I refer to this formula. And then we also, one of the reviewer also said that why don't you consider double robust other causal inference method? So he suggested the double robust and the G formula. So G formula would be a totally different story. So we didn't consider that. Even for double robust method, I think the form of PATT and the PATE derivation would be very different, but I think we try to incorporate that. And then we added those 2 double robust method for PATT and the PATE. Not so sure that would be really too much. And then for the time to event, we also changed from 3 method to 5 method. So the first 3 method would previously proposed unweighted stage 2 weighted and both weighted. Now we are adding stage 2 weighted robust method. So this method is specifically for the survival outcome when there's inferential observations. And then this last one is both weighted robust. So still using robust logistic regression for both stage, but also count for survey weights as well. Those 2 methods are specifically for influential outliers. Then we also, for the time to event outcomes, we try to define, we also define absolute treatment effect and then relative treatment effect, because the survival outcome is different from the binary. The treatment effect is not measured by PATT or PATE. Instead, that's measured by 2 ways. If we use absolute scale, then survival quantile effect is used. So basically the survival quantile effect is the survival difference between 2 groups at different quantiles. And then if the treatment effect is measured by relative scale, then a lot of times we use marginal header ratio. So Cox-PH model will be used. And then we look at this marginal header ratio derived by Cox-PH regression. So there are quite a few more details about how we simulated the data. So here I think I'm just gonna briefly introduce without going too much details. So basically what we did is that we simulate a population with sample size 1 million containing 10 strata, and each strata have 20 clusters with equal size 5,000. And then we randomly sample 5 out of 20 clusters with the sampling probability specified as a sampling weight specified as the following equation, and then try to achieve the total sample size unequally, like for 10 strata respectively. So this simulation scheme is based on Peter Austin 2016's paper, which is also, I think, a good mimic of national survey, usually, which is 2-stage probability, sampling probability. And then we also simulated the covariate related propensity score, which is given a logistic regression as follows. And then we simulate the outcome for binary and the survival specified. For the binary, we use the Bernoulli distribution. Then for the survival outcome, we use the Weibull distribution as specified as follows. And then we also simulated the outcome in the treatment group using Bernoulli and the Weibull distribution again. Then we also consider, after we simulated the data, and then we consider different scenarios, including varying the true treatment effect and also varying the degree of misspecifications. So this misspecification also include when the propensity score is misspecified, as well as the outcome model is misspecified. We also considering varying the overlap levels of propensity score. Then for the survival outcome, we also considering different mechanism for censoring and the different censoring rate. Followed that, we also provided some preliminary result in the proposal, because previously we only proposed 3 methods. So we just reported a relative risk for 3 relative risk of PATT and the PATE using 3 different approaches. Now, because we changed it to 8 different methods, we haven't generated this preliminary result yet, because for each simulation could take more than 2 days. And we have so many different approaches. And then for the survival outcome, we also provided some preliminary results for quantile survival quantile effect. So as we can see that 3 different curve, three different curve represents 3 different approach, and then the solid one is the true treatment effect. Obviously, we can see that both weighted approach are much more close to the true treatment effect. But now I think after switching to 5 methods, we will have 5 different curves here. Then in the aim2, we try to compare the performance of different propensity score estimation method using logistic regression, CPBS, GBM, random forest, and naive Bayesian, and to estimate PATT and PATE for binary outcome and population as survival quantile effect and the marginal hazard ratio for survival outcomes. Then we, first of all, of course, we explain 5 different approaches using the algorithm, which is defined. And then for the model, after define that, of course, we want to evaluate the model performance. So we use 5 metrics to evaluate the model performance. For example, we use we use the average standardized absolute mean difference to evaluate covariant balance. And we also use the absolute mean difference between predicted value and the true value for each model, try to measure the mean predictor error. And of course, we report mean relative bias and the mean absolute bias for estimate of interest. And we also want to measure the coverage probability for the effect estimates as well. So here is the preliminary result for aim2. So in this slide, we try to compare the relative bias using different 5 approaches in deriving the propensity score. So as we can see that when there's nonlinear term included, so looks that naive Bayes and GBM perform slightly better. But right now, we are still doing some simulations for this part. For this part, for the coverage probability, for each round, that will take about 20 days. So I'm not so sure if we can meet the deadline or not for the second, for the resubmission. Then for aim3, once we identify the best performing propensity score method, then we will examine the application of this best performing method to study 2 things. One is the effect of health information technology use, as I previously introduced. Then the second one is to examine the effect of smoking cessation after a cancer diagnosis and subsequent overall survival. So one is for the binary outcome, then the other one is for the survival outcome. So the motivating example behind it is that for the first one, based on our previous investigation, we found that 27% of the patient in our supportive oncology clinic didn't have an activated patient portal. So we were thinking that propensity score method can be used to study the pattern and impact of utilization of telehealth. Here, I think as a simple component, we just use the HIT technology used in improving care delivery, such as reducing unnecessary ED visits and avoidable hospitalizations. The second motivating example is that smoking cessation is, we know that smoking cessation is a powerful cancer prevention strategy. Then based on that, propensity score can be used on this linked data to study the association between post-diagnosis smoking cessation and the subsequent survival using this linkage. Then we did a little bit of research on those linked data, and then found that every variable pretty much can be extracted from those two data sets. So for example, for the first example, we focus on the cohort, which is the adults with a history of cancer. This cohort can be identified from NHIS. Then we also can extract the variable from NHIS, such as age, sex, race, ethnicity. Then for this health in technology use, this variable also can be found from NHIS as well, because in NHIS, the survey specifically asking the participant whether you have used the internet to fill a prescription, schedule a medical appointment, or you have any communication with a healthcare provider using using such kind of technology. And then through the linkage, we can also find their through the Medicare claim data, we can also find their ED visits, hospital admission as well. And then we specify the follow-up window is 1 year of HIT use. Then for the second example, we focus on the cohort. We focus on the adults with a history of cancer who are either current or former smokers using NHIS data. Then in the same way, we extract those baseline covariate from NHIS as well. Then for the through the linked mortality data, we can find the data of their deaths. And then we specifically focus on all-cause mortality and the cancer-specific mortality. We also did some preliminary analysis for both examples as well. So I think we just basically, we found that we have very reasonable sample size, and we also ensure the power, 80% power to detect at least 3.2 difference in the proportion of healthcare utilization between two groups. One group is didn't use HIT at all. Then the other group is, they have experience with HIT. So this difference is equivalent to an odds ratio about 0.8. Very reasonable estimate, I think. Then for the second example, and we also found that we have about 22 very reasonable sample size. And again, we have at least 80 power to detect the hazard ratio, 2 times of the hazard ratio of the mortality, comparing those one who quit a smoke after their diagnosis of cancer to the group, without quitting their smoking after their diagnosis. This effect size is also within the range of reported hazard ratio. But now I think I mainly want to focus on the reviewer comments. I think both reviewers said that the significance is kind of lacking, and due to the novelty is incremental, because someone already did the research in continuous outcome. So specifically, they say that the proposed propensity score methods are not innovative, but are standard in non-survey observational research, and no comparison to other methods for analyzing survey data. The second one, they said, okay, why propensity score was chosen as the solo approach for causal inference for analyzing survey data here, given the rich resource in survey databases, propensity score-based method may not be easily scalable to handle high dimensional confounders. And then the third review said, no proposed comparison with alternative causal inference approaches, such as double robust methods or G-formula. So for this specific one, I think, as I just previously mentioned, we kind of we incorporated the two double robust methods in our revision. So that's more for significance. And then one of the reviewers said, more efficient method for analyzing survey data in the literature were not discussed. So for this specific question, we are thinking that we probably can add one session talking about other causal inference methods in the survey setting. But I would say that pretty much all causal inference method which can be used in the observational study can be also used in the survey setting as well. But no research was done actually to counter for much more complexity of survey data. And one of the reviewers said that there have been research literatures published to address very similar topics, incorporating PS with complex survey data analysis. Yes, because Peter Austin paper said that, but as we adjust, they mainly focus on continuous outcome. None of the study actually focus on binary and the survival outcome. And then some of the reviewer comments are just technical, are focused on technical details, which I think we are fine. We can definitely, I would say it should be relatively easy for us to address those comments. So for example, they say that for survival outcomes, the censoring mechanism was not discussed and more details should be provided. So we were thinking that we can include additional censoring mechanism, including informative censoring or non-informative censoring. And then another comment is they say that they need a more explanation of how propensity approach would be compatible with assessment of nonlinear relationship and interactions, which actually was discussed in the proposal because we consider 3 scenarios. One is main effect. The other one is adding a non-additive term. Then the third scenario is adding non-additive term and then also the interaction as well. Also, they say that it is not apparent whether the parametric propensity score method with logistic regression, assuming only main effect, would be matched with GBM and random forest, allowing which inherently allow for interaction and a nonlinear relationship. But as I said, we already included it. We probably have to make it more obvious or emphasize to different places that saying that we already considered that in the original proposal. And the last technical comments is saying the bootstrap method was proposed for coverage probability, but it's not, he said it's not clear or probably worth investigating the validity of using the bootstrapping with PS method. I think which is also fine because we can find a reference to support, the method, our proposed method. And we also can propose, maybe include one more different method in calculating the coverage probability. I would say that for the technical comment, for the comments focus on technical details, we can certainly improve in this round. But I think, you know, for the significance and for the significance and innovation, still right now we kind of are struggling. So today I really would like to have your thoughts or comments. That's it, yeah, for my presentation today.
Thanks, Lihua. That was a lot to walk through. So it sounds like, can you give us a sense of when this goes to a review group?
Mhm.
I'm hoping it's primarily statisticians who make up this group. Is that kind of the panel that it goes to?
I would assume so, but you know, I also, based on those comments, I would say at least two of the reviewers are statistician, because one of them proposed, you know, double robust method, suggested a double robust methods and the G formula, which is actually, I would say he definitely have a stats background for sure.
Right.
Mm.
You can see the whole panel. Usually that, I mean, it's public, who's not like.
Yeah, yes,
Okay.
yes,
So you
yeah,
can see
yeah. They have whole list of the names there. Yeah, most of them, I think they are kind of professors in the biostats department. But some of them are, I think, have clinical background.
Okay.
Mhm.
I mean, I guess my main comment from these first two is that they really obviously want to expand beyond propensity score methods.
Mhm.
I mean, that's like in your title, so it's kind of hard to like more broadly look at things, but is there a reason that you didn't address like instrumental variables and like some of those other things as comparison points to these methods?
Mhm. Right. So I think that's something that maybe we didn't do very well in the first round, because we jump into propensity score without introducing other causal inference methods, you know, in the proposal. So now I was thinking that right now for this resubmission, I was thinking that maybe we can add one session talking about other different causal inference methods, such as multivariable adjustment, which is often used in survey studies, or maybe propensity score matching, instrumental variable analysis. Actually, in survey setting, I mean, not a lot of innovative methods were kind of used. I also said, you know, I also mentioned that propensity score adjustment by subclassification, or maybe propensity score using the kernel weighting, was sometimes seen, but they are mainly, I think, focused on the non-probability survey, for example, web survey. So maybe I think I should spend maybe one or two. Yeah, but space is very limited. Explain maybe other methods. So talking about, I think the difficulty for me is that I would say theoretically, all those causal inference used in the observational survey, in the observational studies, should be introduced, because theoretically they can be used in the survey setting as well, as long as they can be improved. The problem is that no one is really doing the work to incorporate them into the survey setting. So shall I just start so broadly, or shall I just, you know, narrow down specifically picking some?
is there a way to increase the innovation factor? 'Cause it seems like a couple of the reviewers believe that,
Mhm.
this sort of question about applying propensity scores to surveys has been, done. And I'm trying to think of, and I appreciate that you said that, well, it hasn't been done for dichotomous outcomes, but is that enough really? And maybe there's something that you can add to it to make it innovative.
Mhm. Yeah, yeah. One thing that I was just, based on the reviewer comments, I think I got the impression that some of the reviewer might overlooked the current literature because they saw that, propensity score weight method in survey setting, but they didn't go to the details, whether it's because those previous studies were just focused on the continuous outcome. Those reviewers just assumed that those three papers were just, kind of incorporate, can be applied to all different type of outcomes. I was thinking that what would be the best strategy to emphasize that previous literature didn't actually tackle this area for binary and survival. Like, how should I really emphasize that? For the binary and survival, really no study, no guidance actually.
Yeah,
But
oh, go ahead.
Yeah, you go ahead.
I think that is a real challenge because I will say I have combined survey weights and propensity score analyses, and I use the Eva Dugoff paper, which is a continuous outcome, and like applied it to my binary outcome and like didn't think twice about it, like check, did that. And so I presume that people reviewing this are going to be far more sophisticated in their understanding of the implications of this than I am. But I thought that, just your emphasis of like where this has been done, where it hasn't, and even just like from a grantsmanship perspective, really like hammering that home of even like a table showing like this is the paper, this is the outcome, and showing like here are all the outcomes that this hasn't been studied in, just to again really emphasize that like you do know the literature, you're not overlooking it. It's here is where we don't have any data. And it is tricky, as Melissa was saying, with your title being propensity score, but it does sound like reviewers, if you could add on like as much as you can expand sort of other methods to incorporate the survey weighting, that would probably also show that you're responsive to those critiques.
Yeah, I think that's really a brilliant idea, because we were thinking that because we in the proposal we specifically said no study have examined the binary, no study has examined the propensity score weighting method for survival. But even that, we even highlighted the sentence, they still can just overlook it. Now I'm thinking that, Claire, you are right. I think I probably want to insert a table specifically saying what has been done, what has not been done. That's a good idea. Yeah.
Well, maybe actually, if you could also outline what is the problem of not having this approach being looked at for binary outcomes. So that it can articulate to the reviewers that, it's a problem that you apply the methods that hasn't been tested. So maybe actually some examples or some sort of erroneous conclusions that can be drawn from applying these methods to something that really has been studied.
Yeah, that's a good idea. Yes, yeah, I think that's, thank you so much.
Were there any issues or comments around the specific examples that you brought out? Was there anything in that realm that they didn't like, did that not demonstrate, to Will's point, kind of what the issues are in doing it? You know, how it's currently being done and kind of the more advanced ways you're proposing, or could you make that more obvious in those examples, perhaps?
Those example actually reviewer really, I think they liked it. They actually said the good words about 2 examples.
Okay.
I think mainly what we can show that, you know, the advantage of using more innovative methods, or the correct, more appropriate method should be from the preliminary results. So because really no, you know, there's really no good or bad. I still can say, yeah, there's good or bad, but you know, no really a method is true model, really true model, right? So the only way we can assess, you know, whether the method is performing better than the other is just based on a few performance metrics, you know, measured by performance metrics. So for example, here, this one. So we can see that actually, if we don't use, you know, unweighted method, and then which is the the left one, the bottom left, right? So unweighted, if we just estimate PATE, you can see that the unweighted method can have such a high relative bias compared to both weighted method, right? So which is obvious. And then this is for PATE, and then the same way for PATT, if there's a high high degree of model misspecification, then unweighted method can also have very high relative bias as well, and compared to those, you know, much more appropriate methods. This is, but for the preliminary result, we only provided the relative bias. Actually, we also can provide, you know, coverage probability as well. Just it takes too much time to generate those type of result. Now we are proposing like 8 methods. And also I was thinking that maybe reviewers just overlooked, you know, the paper and missed the important information there. Now I'm thinking that, shall we just change our message to saying that, okay, we should consider weight. Now I think the main message we should convey is that how do we incorporate weights, survey weights, instead of, you know, saying that, oh, weight should be incorporated definitely.
I think that frame switch sounds good. It kind of identifies the challenge greater.
I actually deleted this unweighted message, you know, as a naive sample. Even a lot of times in practice, many statisticians are still kind of providing it. But I was thinking that, okay, so maybe this is distracting them from thinking that the best approach in incorporating the survey weights, and then focus on different approaches in incorporating survey weights. Sometimes I would say, honestly speaking, I really want to talk to those reviewers in person and explain to them that some of the important things that you overlooked.
Yeah, I mean, maybe it's like some of the big picture important reasons you want to do this were lost in the detail of the methods, which is incredibly meticulous in terms of how you've laid it out. So maybe there are ways, and you know, I'm happy to look at it, and others probably are as well, that you can, you know, be repetitive or bold or in a table, like just, you know, keep driving at home exactly why you need to investigate this area and leave enough space for that. Because I know that's kind of how we're always doing things with like the bolding and kind of really repetitive nature of it. So maybe there's some of that just your message wasn't quite as strong.
Yeah. Yeah, definitely. So this is definitely a learning process for me. First time submitted the RO1 and which was not reviewed, which is also very discouraging.
Yeah, it happens to all of us. That's as long as the comments are addressable, just based on how you presented it, it seems like in large part they are.
Mhm.
You know, that doesn't matter as much.
So for this second submission, for this resubmission, we are using like two servers, two computers, try to generate some preliminary results. Hopefully we can meet the deadline.
So so I have to confess, I don't know a lot about in terms of the methods type of proposals, but you know, one way that you know, in proposals that we would think about significance is thinking about what type of products or what type of things that can actually drive the field forward, and whether, you know, this is the type of proposal that could actually say, you know, if you are thinking about how to incorporate waste, or are you going to generate some sort of manual to say, oh, this is how you do it, in what situations, or some sort of thing that maybe the clinicians can use in the field. Those are things that actually that may actually be that may speak to the less statistical part of the panel. So
yeah, that's good idea. Because right now, I think in each innovation, we were just thinking that, okay, not just simply saying that this is the first study doing this, this is the first study doing that. We were also thinking that we should also provide our product as well, just generating a package so people can easily use, right? And then because the best performing model will be identified based on the simulation study. And then we pick that best performing method and then create a package. Then people can, clinicians, practitioners, also biostatisticians can use this package when they are using the survey data.
All right, well, thanks so much, Lihua, for sharing this. Good luck with the resubmission.
Thank you so much. And thanks everyone for your comments and suggestions. Definitely will incorporate that and keep working on that.
Okay. When is it due?
The end of October.
End of October. Okay. All right, great. All right, well, thanks so much, everyone. Thank you for your comments and participation. We'll see you in 2 weeks. Bye.
Bye.